Arts and medicine started as a dream, of course. We have been kind of making a slow foray into arts and medicine over the past few years at the Alice Stevens Center. It was of great interest to Jordan DeMoss, who is the Assistant Vice President of UAB Hospital, and he always had a vision for bringing arts into the healing environment.
I think we've become so focused on the science of medicine that we forget about the whole person. So I think it's the whole paradigm shift from treating the disease to treating people.
We started a pilot. We got some funding from the UAB Innovation Board, and we brought in trained artists and residents for 10 hours a week into various units at the hospital.
Well, it's given us another avenue to treat our patients with compassion and something different, and they need that. They need something different because they're facing cancer, and they know that what the outcome can be. It's very stressful. It's very stressful for the caregivers and the families as well, and this has enabled us to provide something different.
The artists and residents who are part of UAB's Arts and Medicine program are truly unique individuals.
I'm a sewing enthusiast, a textile enthusiast. I quilt, I embroider.
I provide really bad jokes. That's one of my great gifts for the patients.
I provide writing and acting to the patients, and I also sometimes do poetry depending on what they want. I recite Shakespeare monologues for some patients.
In terms of being in the women and infant care building, I like to think that this art form really is for them in terms of waiting for this new life that's coming, and just the act of putting stitches, slowly. We know that sewing can reduce blood pressure, can reduce heart rate, can just calm you down.
You can measure and you can see that people's pain decreases, their anxiety decreases. We know that we can't cure everything. We know we can't cure every disease. We know people will not overcome some of the things that they have and that they come to us with. But we can develop and help them get to a place where they're comfortable, where they're peaceful, where they have quality.